Thank you for choosing a DeVilbiss Oxygen Concentrator, and welcome to the operational video. This video is intended as a patient visual usage, cleaning, and maintenance guide, and is in support of the full instruction manual included with every oxygen concentrator. Please note, this product is only to be used by or on the order of a physician. Your physician has prescribed supplemental oxygen. Based on your liter per minute need, your equipment provider will set up the DeVilbiss 5-liter or DeVilbiss 10-liter oxygen concentrator. In this video, we will provide an overview of important parts of your concentrator, setting up and operating your concentrator, cleaning and maintenance of your concentrator. The DeVilbiss Oxygen Concentrator is intended to provide supplemental low-flow oxygen therapy for patients suffering from COPD, cardiovascular disease, and lung disorders. It is designed for use in homes, nursing homes, patient care facilities, and other similar environments. When using this electrical product, always follow the basic safety instructions referenced in this video and in the instruction manual included with your unit. A quick reminder, oxygen causes rapid burning. Do not smoke while your oxygen concentrator is in operation or when you are near a person utilizing oxygen therapy. Keep the oxygen concentrator and cannula at least 6.5 feet from hot, sparking objects or naked sources of flame. Use of the 5-liter concentrator at an altitude of above 13,123 feet, above a temperature of 95 degrees Fahrenheit, or in greater than 95% relative humidity may affect the flow rate and oxygen concentration, impacting the quality of therapy. Before attempting any cleaning procedures, turn the unit off. Use of harsh chemicals is not recommended. If bactericidal cleaning is required, a non-alcohol-based product is recommended. Do not use petroleum-based solvents or apply any liquids directly onto the cabinet. Failure to follow product instructions could result in personal injury and/or damage to the product. Never open the concentrator cabinet. The cabinet should only be removed by qualified DeVilbiss technicians. Let's quickly review the main parts of your 5-liter DeVilbiss 525DS oxygen concentrator. Warning label. Green power light illuminates when your concentrator is operating properly. Power switch. Flow meter knob. Flow meter. Circuit breaker resets the unit after electrical overload shutdown. Oxygen outlet. Oxygen is dispersed through this port. Normal oxygen light. Low oxygen light. Red service required light. Hand grip. Exhaust. Power cord. Power cord strap. Air filter. Auxiliary oxygen outlet port. As you can see, the base of the unit and the labeling are visually different on the 10-liter DeVilbiss 1025 DS oxygen concentrator. However, the main parts of your unit, such as the power switch, flow meter, and flow meter knob location, are the same. The operating lights differ slightly. Please refer to your product usage instructions for full product information, cautions, and safeguards. Before first operating your unit, your provider will verify the air filters on the back of your unit are clean. Thread the oxygen outlet connector onto the oxygen outlet. Then, attach the oxygen tubing directly to the connector. If your physician has prescribed humidification as part of your therapy, the oxygen outlet connector is not needed. Fill your humidifier bottle with distilled water and place the lid back onto the bottle. Thread the wing nut on the top of the humidifier bottle directly onto the oxygen outlet. Attach the oxygen tubing directly onto the humidifier bottle oxygen outlet. If your oxygen tubing is not already connected to a cannula, You or your provider may do so with a tubing extension connector. Remove the power cord from the line cord strap and plug the cord into the wall outlet. Turn the power switch to on. All the lights will illuminate briefly and a brief audible signal will sound. After a few seconds to a few minutes, depending on your setting and if you are operating the 5-liter or 10-liter unit, the normal oxygen light will illuminate and remain lit. Check the flow meter to make sure that the flow meter ball is centered on the line for your prescribed flow rate. Your equipment provider will do this during initial setup, but you should verify the setting each time you use your oxygen concentrator. Your DeVilbiss Oxygen Concentrator is now ready for use. Properly position your cannula or mask. If your oxygen concentrator sounds a visual or visual and audible alarm for low oxygen purity, switch to your backup system and contact your equipment provider. It's essential to maintain your unit, cleaning the cannula or face mask, the exterior of the concentrator cabinet, humidifier bottle, outlet connector, and air filters periodically. Be sure the power switch is in the off position, indicating the unit is turned off before cleaning the unit. Clean and replace the cannula or mask, as well as tubing and humidifier bottle, according to the manufacturer's or your provider's instructions. Remove the rear cabinet air filter and outlet connector, and clean at least once a week. Wash in a solution of warm water and dishwashing detergent. Rinse thoroughly with warm tap water and towel dry. Be sure the air filter is completely dry before reinstalling. Your intake bacteria filter should not be washed. This filter requires less frequent maintenance and will be changed at the appropriate time by your equipment provider. Clean the concentrator exterior cabinet by using a damp cloth or sponge with a mild household cleaner and wipe it dry. All additional maintenance must be performed by an authorized DeVilbiss service professional. Thank you for choosing a DeVilbiss product. For more information, please visit drivemedical.com or contact a DeVilbiss representative at 1-800-694-5085.